2021, 28% of the estimated 10.6 million people who fell ill with tuberculosis across the globe were in India. Tuberculosis, a leading cause of death among communicable diseases in India, takes approximately 0.4 million lives within the country every year. As per World Health Organization, world's highest tuberculosis burden exists in India, with approximately 1/4 of the total tuberculosis cases in the world. In March 2018, Honorable Prime Minister Shri Narendra Modi gave the clarion call to end tuberculosis in the country.
भारत को 2025 तक टीबी से मुक्त करने का लक्ष्य कुछ लोगों को मुश्किल भले लग रहा हो, लेकिन ये असंभव नहीं है। पिछले 4 साल से जिस तरह हमारी सरकार नई अप्रोच के साथ काम कर रही है, उससे इस लक्ष्य को प्राप्त किया जा सकता है, ये मेरा पूरा विश्वास है।
5 years ahead of SDG target of 2030 at the End Tuberculosis Summit in Delhi, propelling the efforts by bringing together community and other stakeholders to support and accelerate the country's progress towards tuberculosis elimination. On 9th September 2022, Honorable President of India, Srimati Draupadi Murmu launched the Pradhan Mantri Tuberculosis Mukt Bharat Abhiyan with a vision of achieving Tuberculosis Mukt Bharat by 2025. Steadfast in its contributions towards achieving national goals, standing tall with the motto of Pehle Indian Phir Oil, Indian Oil too has framed policy for TB Mukt Indian Oil Parivar and a corresponding action plan to be implemented across all divisions with a goal to achieve TB Mukt Indian Oil Parivar by 2025. The action plan shall be implemented in phases covering Indian oil workforce across the corporation with a 3-pronged approach. Screening camps will be organized at various Indian Oil locations for employees, contract workers and their families in Indian Oil townships with the help of respective district tuberculosis officers of the Government of India to detect the presence of any warning signs of the disease on premises. Through effective liaison with designated district microscopy centers, DOT centers and district tuberculosis officers, Indian Oil will ensure testing, access of tuberculosis drugs, awareness about and adherence of treatment guidelines for its employees and contract workers. The action plan also includes building awareness and sensitization about TB through workshops on tuberculosis prevention, control and treatment, supporting treatment of tuberculosis, capacity building and adoption of a TB pledge, and observation of World Tuberculosis Day on 24th March each year. For creating awareness on tuberculosis prevention, posters and messages shall be physically displayed and widely circulated among the workforce, while short videos, pre-recorded messages aiding the cause will be broadcasted on all Indian Oil social media platforms. For building in-house capacity, Indian Oil will conduct training and workshops for Indian Oil medical doctors, paramedical staff, nurses, empaneled and visiting doctors on diagnosis and treatment of tuberculosis. The overall progress of the implementation of the action plan will be monitored through a dedicated online portal, that is Tuberculosis Dashboard. Once all the locations are declared tuberculosis free, Indian Oil shall be declared TB Mukt Indian Oil. As a socially responsible organization, Indian Oil has always spearheaded initiatives aimed at social welfare. Today, as we commit ourselves to the successful accomplishment of this objective, let us take a pledge to eradicate tuberculosis from Indian Oil and play our part in contributing to the national goal of Tuberculosis Mukt Bharat.